Prevalence rates for autism spectrum disorder continue to climb, with current estimates that approximately 1 in 36 children meet diagnostic criteria for ASD. We also know that the percentage of American school children receiving special education services because of an autism eligibility doubled between the years of 2008 to 2018. Autism occurs in all racial, ethnic, and socioeconomic groups, but there's plenty of data showing persistent rates of under and over identification for many groups, including Black and Latin children, as well as girls and women, to name a few. Discussions around assessment and identification of autism are nuanced because it's a complex diagnosis, making the evaluation itself intricate, in addition to issues of people being overlooked or misclassified. WPS's Professional Learning Center ProLearn is delighted to host Dr. Michael J. Morier for a webinar discussing these issues and more. Dr. Morier will be presenting an overview of ASD diagnostic criteria, an overview of various models of ASD, as well as topics related to autism within diverse populations. I'm Stephanie Needler, an assessment consultant with WPS, and today I'm privileged to speak with Dr. Morier, a board-certified behavior analyst and renowned expert in autism diagnostics and early intervention. Dr. Morier is the owner and managing member of Morier Consulting, LLC, where he leads training for individuals and professionals in state-of-the-art diagnostic assessments for autism. Prior to this, he was an associate professor in the Department of Psychiatry and Behavioral Sciences at the Emory University School of Medicine. Dr. Morier has dedicated his career to improving the tools and techniques used to identify and support people on the autism spectrum, particularly in community-based settings. His experience includes expanding telehealth platforms for autism diagnostics and supporting inclusive practices in diverse populations. Dr. Morier, thank you for joining us today.
Thank you for having me. I appreciate your time and effort in expanding people's knowledge on this topic or these topics.
We're happy to have your expertise. You've spent over 3 decades working in autism research and intervention. Can you share what initially drew you to this field and some early influences that shaped your approach?
Really, what drew me to this field was when I was an undergraduate student. I was probably going between my sophomore and junior year. I started working at an inclusive summer camp where there were these 2 children that just kind of like fascinated me. And they were just so different than all the other kids that were enrolled in this camp. And, I was kind of like halfway through the summer, I was like, so what diagnosis do these kids have? And someone said autism. And I was like, oh, what is that? I mean, I've never heard of it before. It was something that kind of fascinated me, watching how they interacted with the world around them. And that I just kind of followed them and found out where they were at school. And they were in a inclusive preschool, research-based preschool at the University of Massachusetts. And I was trying to transfer there. So I started working at that preschool, and really that's what built my career. And really my mentor at the time, Gail McGee, has been a real influence in my career in going forward, as well as probably the individual children that I've seen and worked with, as well as the families. I mean, they really have shaped how I viewed not only treatment, but the diagnostic process, and how can we make it easier for families as we go along.
That's amazing. The personal connection that's kicked off this career, this rich career of research and intervention. I'm curious, what are some of the main challenges in autism research and intervention when you started, knowing the history that you have, and how has the field evolved in terms of addressing those needs?
I think the biggest challenge when I started was just people's knowledge of autism. I mean, as I said, like I didn't even know what it was. I hadn't heard of it. And people just didn't know what it was. And I remember traveling and someone asked what I did. And I said, I worked with autistic kids. And they were like, oh, you must have a lot of artwork around your house. I was like, why would I have artwork in my house? And they're like, well, you work with artistic kids. I'm like, no, not artistic, autistic, So just kind of what it was and who were these kids. And really at the time I started, we were doing young children. And at that time, young was 4 to 5, to start treatment. And really go on. And so, really knowing how we can identify kids that are at increased likelihood of having this diagnosis and being able to start treatment really young has really been the best advance, I think, going forward. And really being able to pinpoint what is autism and how can it be seen in diverse populations. It's not based on just as we used to think the kind of like upper middle class white boy. Autism is wide ranging and it's a spectrum. And how can we kind of identify people that are in that spectrum and not identify people that are not in that spectrum? Because it used to be, there was kind of a time where kind of everyone became autism, and then there was a time when no one had autism. So kind of going through and figuring that out has really been the best challenge and that we've overcome, I think, going forward. We still have challenges to go and things to overcome, but that's really who are we talking about when we talk about autism has been big.
Certainly, it's been a process over the years, and I think you spoke to this importance of early identification and early intervention. We know now how crucial that is to be able to identify people early, which I think then speaks to this over and under identification issue that we face with a lot of populations. I have a few questions for you on this topic. You've really worked extensively with community-based practitioners, I know, and what are some of the biggest obstacles they're facing in diagnosing and supporting people with autism?
I think with the community, one of the biggest obstacles has been experience with autism. Because they tend to, and not everyone, but they tend to get kind of those kids that are easily identified. And once they get that kind of more complicated cases, they're not as sure. And so they may be like, okay, the parents really want this, let's give it to them. Or, look, I really don't think it's this, even though they meet the criteria. So really having that wide range of experience and staying up to date on assessment practices, on kind of what do you do, how can you do this, and not just like, oh, insurance is requiring this, so I'll give them this, this, and this, and kind of go on. But what is this tool in my toolbox, and what is my toolbox, and what can I use for this individual child, instead of just kind of like, here's my set protocol and I'm going to move on no matter what, which can under or over identify kids.
Hmm. Yeah, so I'm hearing you talk about this individualized approach being really important and having multiple
Mhm.
viewpoints maybe within evaluation
Right,
teams to uncover what folks are looking for.
right.
So within that, your work emphasizes really the need for reliability then among clinicians in diagnostic criteria. And um, what strategies have you found to be effective, that is, for achieving reliability?
Yeah, reliability on diagnostic practices is a tough one, because a lot of people are out there solo, and they have their solo business. People are coming in, and really, how do you get that network to make sure that you are not drifting based on your beliefs or your, perceptions? And so there's been a lot of things that have been started, mostly during COVID when everyone was kind of by themselves. There's been groups. One of the best out there that I've seen is through Weill Cornell, and they have two groups actually. One is GAIN. Don't ask me what it stands for. I think it's Global Autism Interactive Network, where basically clinicians can get together and they review tapes of kids. It's mostly based on the ADOS, and they kind of watch tapes and they code it, practice it. Then the experts talk about it and how the coding and what the spirit of that code is. And you do that every month and you go through every module, and it really keeps you updated on kind of what the current thinking is. There's also the IDEA group that is really looking at just diagnostic practices across the board on autism. So they've had talks on gender diversity. They've had talks on, females, telehealth practices, screening tools, and things like that. So really just staying connected with people and knowing kind of I can do this, and let's practice and get feedback. I know people have set up their own little groups in their community. So let's get together at least once a year and we'll just kind of look at a case and we'll do it together. And how are we doing it? So people and families know if they come to us, or anyone here, we're going to give you the same diagnosis. And it's not so much based on just individual beliefs or individual values of the diagnosis. So, really staying connected to people is the best way to stay reliable, I believe.
That makes a lot of sense. I mean, just that professionals getting together to ensure that they're not siloed, right? We're all
Mhm.
conceptualizing autism through the same lens, I think is really valuable. Um, how do you view the role of cultural and gender diversity in autism diagnostics? We're talking a lot now, which I think is great, about culturally responsive assessment and over and under identification. We're talking a lot about girls and women, Black and Latin children too. What changes would you like to see to ensure inclusivity in assessment?
I think the biggest change to include inclusivity is really for practitioners to know their own biases going in. Like what are you expecting or what do you believe about this population of children? I mean, there's a lot in just the special education research looking at how attitudes of teachers influence referral rates. How do their attitudes influence how they treat kids or what interventions they get in the school system. And so I think looking at that from a diagnostic standpoint, like what am I bringing in and how can I kind of leave that aside and know, yeah, culturally things are different, but they're the same too. Like there's a big thing everyone talks about, eye contact. It's really big across culture. Yes, it is. But if you know enough about that culture, you'll know, is it good or is it bad? Is it a problem? Is it not? Listening to the parents. And, parents don't always know exactly what to say or how to say it, but listening to them. What are they really trying to get at and really bring it that way? And leaving our biases at the door. When a kid comes in, you're seeing them as a kid, or an adult comes in, you're seeing them as an adult. And really they're an individual, and how can we look at what they're presenting and does it meet that diagnostic criteria going forward?
So that the importance of doing some inner work first, which I think is really valuable, but then partnering with individuals and families and understanding their culture and context,
Yeah,
right?
yeah,
Their symptoms and context.
that's big. Yeah.
Given your work in training people on the ADOS 2, can you explain some of the specific features that you think make this tool in particular reliable for diagnosing autism across ages and developmental levels?
Yeah, I mean, the ADOS 2 is really one of the assessments I love doing. I think it's one of the few out there that really allows you to create the social context and that social world where you can really see what is this child's strength and what is this child's areas of need. Well, really taking out a lot of the issues that you get into, like their language level. The ADOS is based on the individual's expressive language level, and how much do you press for social things? How much do you back off? What are you asking? What are you doing? And all that creates really that social context where you can see what's going on with that individual. And, the way they have it set up and the way the developers have made it, where it's really looking at, okay, here's an individual, this is where their language level is, this is how I can press them to get these social contact. And it's the same across context. It just gets harder. The social demands become more as your social skills increase based on your language level. We all know language and social skills are tied together. So, really, how do you make sure you are giving the individual enough support to see what they can do, but also see where they have those areas of need, and really take it away from, again, this is my bias coming in. I think they should be doing this. Well, no, this is the definition of what we're looking for. It really operationalizes social behavior more than any other assessment I've ever seen. I did my graduate work in special education, and we always talked about social skills, but no one defined it. We all just kind of assumed we knew what social skills were, where the ADOS really helps break that down. Is the child initiating? Are they responding? What is the quality of that? How is it leading to another social interaction at all ages? So you kind of have that baseline you can go through, and based on the amount of expressive language the individual has, how much do I have to push to get that?
Mhm.
going through. And so that's what I think makes it one of the best assessments out there.
I want to pull on this thread a little bit of social communication and social behavior based on everything that you just said. So I know this is an area of your expertise. What are some specific examples of social communication or interaction supports that you found to be effective in inclusive settings? And the reason I asked that question after the ADOS 2 specifically is this link, I think, which is really valuable between that rich information that the ADOS 2 can get you and then bridging that into intervention. So yeah, just curious, social communication, social interaction supports that you have found to be effective.
I mean, again, it's really individualized on the child. But really, I think knowing, again, what they can do and using their strengths to build on that, and really supporting the individuals around them as much as you're supporting that child. You know, if you think about it, if you're a young kid and you're in school and you keep going up to someone and asking them to play with you and they are not responding to you, you're eventually going to give up. You know, so how can we get them to understand, this is how he's communicating, and really being there, helping set up the environment, set up the situation, and then back off as the kids are being successful and come in when they need it. Either group needs it, and then backing off and coming in, because research shows if there's a especially child-child interaction going on, or child-child conversation, an adult jumps in, everyone's going to talk to that adult, and you kind of break that whole child-child skill that we have been struggling so hard to teach. So you want to keep it going, but we get so kind of stuck on the, oh, we have to have them talk and request 7 times during the next hour, and it's not that. It's, are the kids playing? Are they interacting? Are they being successful going forward? So really knowing, what are you going for? How does the child with autism do that skill? And how can you help the individual without autism who's interacting with them understand that's what they're doing and kind of go forward, and then moving on from there?
So really valuing, I think, authenticity in interactions is
Yeah.
really valuable. And I'm hearing, being nimble in our approach, right? And how
Yeah.
much support we're providing as we're observing
Yeah.
children developing these skills. So, Dr. Maria, you contributed to the CDC's Autism Surveillance Project for over 2 decades. Thank you for that. What were some of the most valuable takeaways from that work, and how did it shape your understanding of autism prevalence and diagnostic trends?
That's a loaded question. I think the the thing I learned the most is that you could define autism and reliably have it be assessed across different um, areas, different social contexts, different individuals who were reliably looking at it, and you could do that reliably. You could count kids reliably going across. That was one of the biggest things I learned. I think kind of how it shaped me was really understanding that there was a lot more autism out there than we originally thought. Because if you look at a record and you're kind of going through and you're looking at it and you're like, oh yeah, that's a criteria, that's a criteria, that's a criteria, or no, that's not. Going through and really being able to, they had it so defined that you knew what criteria you were going into. And it didn't matter if we changed criteria. When we went from DSM-4 to DSM-5, they were able to keep up with that, and they started planning that ahead of time. How can we keep this going? And how can we train and keep all of the clinical reviewers, which I was, reliable on this? And really not have us be part of the team that was determining the numbers. We were there. We were kind of the objective determinants, and then they determined the overall prevalence. So we didn't influence that at all, what was going on. So really doing epidemiological work, it was the first time I ever was involved in it. And I mean, I found it just so fascinating. I actually thought about at some point going back and getting another master's in it, but then just decided I don't have time, and I'll let them do it.
Well, I love to hear all of the service and all of the work that you have invested in this. And always being future focused, right? There are new clinicians that are out there. There are people that are as jazzed about this as you and I are. What are your hopes for the future of autism research and treatment?
I think my biggest hope for the future in autism treatment is, or research and treatment, is that we can stop fighting with each other. Like we don't have this, we don't have to say this treatment's better than that treatment. Yeah, it may have a better outcome at this point, but how can we use our knowledge in this area to help support knowledge in that area? And, not necessarily fight over, um, you know, who's getting treatment, who's not getting treatment. With every state having insurance laws now, treatment should be available to all individuals that need it, but it's still not. So how can we get there? How can we get the providers able to serve the number of kids that there are? I mean, there's always going to be probably more kids than we have providers for the treatment, but really, how can we figure that out and get kids what they need and not kind of, oh, it says you have to have this many hours of treatment, but okay, what can we provide for this child? What does this child need as an individual, and keep it going and not just follow a curriculum? For research, really looking at what are those early signs. There's so much coming on now with, being able to pick up those behavioral characteristics as young as 6 months, but there's not a treatment to do it. So how can we do, and not just water down a curriculum, but really target what are those early social communication behaviors, and how can we help families do this as well and really be a meaningful part with the family through the whole process, and what are they going through, instead of having this kind of like, not just with families but with other providers, us them situation. We really want to make sure we're working together, because the children and the individuals are really who's important, not me as a provider, but also being able to know how can we support those individuals that are beyond early childhood. How can we support adults, and what do they need, and really listen to them and listen to the individuals with autism on this was helpful, this was not helpful. How do we describe it? And there's the different models of autism. There's the medical model and there's the social model, and how can we kind of combine those so that it's not an us them situation, but it's we're helping everybody get what they need to be the most productive person they can be based on their current skills.
I mean, beautiful, right? A more collaborative, a more accessible, a more supportive future where people with autism are in the driver's seat, right?
Right.
Them and their families become the focus of the work that's being done, right?
Right.
That's the most important thing.
And not always looking at it as it's a problem. Like I know when I first started this, if a kid hand flapped, we were like, no, you have to stop hand flapping. You have to do this. And, now it's like, is it hurting anybody? No, it's not. So, if that's just the way someone needs to cope or kind of reduce their anxiety, that is fine. When I get anxious, I chew on a pen. No one tells me to stop doing that, and so why can I do something that calms me and kind of I can cope my coping skills, but someone else's is bad, and not looking at it that way, but looking at, again, how is this individual dealing with the environment that they're in, and how can we support them to be successful in that environment?
Absolutely. I mean, we're getting to a more and more neuro-affirming place, I feel like, but there's a lot of work left to be done. Um, but I am pleased to hear that we're starting to have that kind of outlook, right? I think
Right.
that's really
Yeah.
valuable. Well, Dr. Morier, thank you so much for joining us today, for sharing your expertise and giving us a taste of what we can expect from your webinar. I'm very excited for that. It's undoubtedly going to be enriching for attendees. And more importantly, I think it's going to be of benefit to the people that they serve, which is the goal here. So thank you for partnering with WPS to share your knowledge and to help unlock potential.
Yeah. Well, thank you for inviting me to do this interview plus the workshop and webinar. I'm excited to do it and really get the information out there, because there are so many people I run into that are just like, I have this question, this question, this question, and I know the 2-hour webinar is not going to answer everyone's question, and they'll probably leave with more, but at least it may spark some conversation or some thought on how can I take this and incorporate it into what I do on a day-to-day basis.
Absolutely. Making practice better and better. And we appreciate you for that. Thank you so much.
You're welcome.
Visit WPS today to start unlocking potential.